Good morning, everyone. Welcome. Thank you for coming to Connecticut Children's today. My name is Teresa Hendrickson. I'm the Executive Vice President and Chief Operating Officer here, and I'm happy you could all join us this morning as we welcome the holiday season and what has truly become an important initiative for our community. As the state's only medical center dedicated exclusively to caring for children, Connecticut Children's is most widely recognized for the highly specialized care we provide to children and families from all across Connecticut and southern New England. And as proud as we are of this recognition, we feel our mission entails a little bit more. And that is not only to take care of children and young adults after they are ill or injured, but to be a leader in preventing those illnesses and injuries from happening in the first place. Our vision is to make the children of Connecticut the healthiest in the nation. Through our programs such as Injury Prevention Center, the Violence Prevention Center, Safe Kids Connecticut, and the Injury Free Coalition for Kids, we are working hard to make growing up in our community and state safer and easier. Today, we gladly join our partners from Hartford Hospital, St. Francis Medical Center, the City of Hartford, and Hartford Police Department on a program that will directly impact our collective goal of making our community a safer one. It's now my pleasure to introduce Dr. Brendan Campbell, the Director of Pediatric Trauma at Connecticut Children's, to offer more insight into this initiative.
Good morning, and thanks everybody for coming out this morning. When toddler Wyatt Mattel found his father's loaded pistol under a pillow in their Jewett City home and accidentally shot himself in the head, the result was predictable. LifeStar flew him to our Level 1 Pediatric Trauma Center in Hartford, but there was nothing that we could do to save his life. Public health research has clearly established that the unsafe storage of firearms increases the risk of both accidental shootings as well as suicides. It's our hope that this program will both remove unwanted guns from Connecticut homes and increase awareness about the importance of safe firearm storage. This gun buyback program dovetails nicely with the Hartford Police Department's shooting task force that targets high-risk criminals, and Project Longevity, which Attorney General Eric Holder announced in New Haven earlier this week. If Hartford's gun buyback program prevents a single child from being killed or injured by a shooting, this program will have been worth it. We need only remember the potentially preventable death of Wyatt Mattel from Jewett City. If you have an unwanted firearm in your home, return it for a gift card, so that it doesn't find its way into the hands of a child or a criminal. If you choose to keep guns in your home, make absolutely certain that it is stored safely and out of harm's way. And so with that, I'd like to conclude my remarks and introduce Mayor Pedro Segarra from Hartford.
Thank you, and good morning. Very privileged and honored to be here again this year to continue this very worthwhile program. To have our three major medical institutions partnering up with others, with our police department and others in this effort is worthwhile. As Dr. Campbell said, one child that can benefit from this effort is worth the effort. Our city continues to support this program because we're definitely trying to get the guns out of the street. We know that through this effort, we have bought many guns back from the community. The city of Hartford has been able to work collaboratively with Hartford Hospital and St. Francis and the Children's Center in the past. And I believe that last year was 222 weapons. I'm trying to find out the exact number.
18, but total of over 200.
Over 222 firearms have been purchased through this program. This, in addition to guns that we have been seizing off the streets through our police efforts, 93 for the shooting task force alone since its inception, is making our city safer. In fact, although statistics show that our city is now safer than it's been in the last 30 years, we know that we still have some ways to go in terms of continuing to reduce violence and reduce shootings and homicides. We basically accomplish this by trying to understand that we need to undertake this and other efforts. So PROSPER program, the Shooting Task Force program, our ability to coordinate with the federal government through their initiatives also helps in this effort. I'm also working with Mayors United against gun violence, and Mayor Bloomberg from New York City and Mayor Nutter from Philadelphia are helping to coordinate and lead that effort, and we hope to also work with our federal delegation in terms of creating national policy that can track the guns and create a more regulated environment in terms of decreasing the way that we have such a prevalence of guns in our neighborhoods. Now, for someone who grew up in the South Bronx, for someone who constantly went from apartment to apartment with childhood friends, I cannot even begin to tell you how many recollections I have of seeing little ones around guns. And it is something that still happens. So this effort will hopefully get the word out to parents and families of the risk that is inherent in keeping firearms, especially unsupervised firearms, sometimes often firearms that are not being kept with any degree of safety, to turn those guns in, to make the lives of our children safer, to make sure that firearms are not available to people who have history of depression, people who really should not be around guns, and to even encourage them to bring those guns in. Now, I don't know what our budget limitations are in terms of buying back guns, but I do hope that if we get to the point that we have more guns than we have money, that you contact me, contact our chief of police, to see what we can do to make sure that every single weapon that we can buy back, we buy back. Again, I want to thank Hartford Hospital, St. Francis, Connecticut Children's Medical Center for partnering up. We know that great things can come by joining together and sharing the responsibility and sharing our resources and getting it done. And with no anything further to say, I want to introduce someone who's really been a really great partner in helping us make sure that we reduce our numbers of homicides, shootings, and access to guns in our city, and that's our Chief of Police, Chief James Ravella.
Thank you, Mr. Mayor, and good morning to everyone, and thank you very much for coming today. This is a very important event for not only the city, but the area surrounding the city, the region. A recovery of a gun, taking a gun off a street, or taking it from a house, or taking it from a child, or taking it out of somebody that has psychological issues is so extremely important, especially around the holidays, isn't it? And the key word here is prevention. Boy, and that is a dial that we're turning in our police department to prevention. And it's very unusual for my police officers, but they're doing a great job doing it, the preventative part. And it only benefits every family and every friend and every associate you have. But let me turn back the clock just a little bit. We've all been in that situation where we've had a personal loss, a family, a friend, or a professional loss. And we thought back to ourselves, boy, if I only could have connected the dots earlier in life, right? If I saw this, or if I put this together, if I got him help here or did this. And that's essentially what we're talking about, ladies and gentlemen, are connecting those dots of the constellation before they occur. The prevention part of this, before they occur. So we'd be asking everyone out there, if your family, if your friends, or if your associates, of people that have guns in their house, around little ones, around people that shouldn't have them, even around violent crime, we're asking you to bring those guns in. Bring them into the CRT building on Saturday. Because we have a very unlikely motto that I want to share with you. It's a motto that was adopted by an unlikely associate of ours, the Internal Affairs Division. And what they've adopted is, and which is unusual for our police department, if we can predict it, we can prevent it. If we can predict it, we can prevent it. And that is that constellation of stars that we're connecting before the event happens. If we can predict it, let's prevent it. Let's get those guns off the street, out of the houses, and into hands, and we'll take care of it from there. So Thank you very much, everybody, for coming, and I'm entirely happy with the support and where we're going with this program. Year after year, we've taken a lot of guns off the street that potentially could be just harmful to our little ones and to other citizens. With that, I'd like to announce Kate Roach.
Good morning. I'm the Executive Vice President and Chief Operating Officer at St. Francis Hospital and Medical Center, and I'm really honored to be here today with Hartford Hospital, Connecticut Children's Medical Center, Mayor Segarra, and the Hartford Police Department. This year, Hartford has really seen an encouraging decrease in shooting incidents within our city's limits. The mayor and our brave law enforcement officers deserve our deep gratitude and thanks for this life-saving progress. However, this is not and has never been a city issue. It's really why we're here today, calling upon our community to support this gun buyback initiative. At St. Francis, we see firsthand the lives and families destroyed by the misuse of firearms. And as a former trauma nurse, I've also seen the impact of gun-related injuries and felt the grief of loved ones left behind. I have a brother who is the victim of a shooting. He survived the incident several years ago, and it was a misfired arm that was in the wrong hands. And he survived, but he has lived with the complications of that for quite some time. So it's a very personal issue to me as well. The gun buyback gives our community a chance to change this. It's about keeping unwanted firearms out of our homes. It's about prevention and safety. It's about keeping our families and our neighbors and our coworkers safe. As you've heard from Mayor Segarra, since its inception, the gun buyback program has recovered over 250 firearms since 2009. And our hope at St. Francis is that this year's event will once again help reduce violence and save lives in the communities that our hospitals are privileged to serve. And it's now my privilege to introduce Dr. Len Jacobs, who's the Director of Trauma at Hartford Hospital. Dr. Jacobs?
Well, good morning, and Mayor Segarra, thank you for being with us. This is an important time. This is Thanksgiving time, holiday time. And just think for a moment of just what one gun and one bullet can do to a family, and how it can destroy Thanksgiving, how it can destroy a holiday. Taking that gun off the street makes a huge difference, because as the police chief said, if you don't have the gun, you're not going to have gun injury. If you don't have gun injury, you're not going to destroy a family. It is really devastating to anybody, but particularly so to the child that Brendan Campbell talked about. The kinetic energy of one bullet on a little person is incredible. The destruction to that person and the destruction to the mother and the father and the family and the community is huge. So the fact that communities of security people, police people, health people, like the 3 hospitals and centers in this town, that can come together and sharply focus about preventing and decreasing injuries is very important. And I would like to now introduce Mr. Neil Orrick, the VP for Finance and Administration of Community Renewal Team, because his group has been extremely helpful in removing these guns from the community and taking them out of the hands of people who shouldn't have them and preventing this terrible thing. Thank you so much.
Thank you, Dr. Jacobs. Community Renewal Team is a proud partner in the combined efforts of Connecticut Children's Medical Center, Hartford Hospital, St. Francis Hospital, the City of Hartford, and the Hartford Police Department and the State's Attorney's Office in working towards these guns-related injuries, deaths in our community. Each year, the results of our gun buyback program are proof that a trusting relationship between law enforcement, our local medical facilities, our community members can be a powerful crime prevention strategy. And we are looking forward to our continuing work towards keeping our community safe from gun violence. And with that, I'll turn this back to Teresa Hendrickson. Thank you.
I want to thank all of you for coming today, especially our speakers who are dedicated to keeping the children and all of us of Connecticut safe each and every day. I hope you're all able to capture the same spirit of the season that we get to capture here at Connecticut Children's, and I wish you all a safe and happy, but most importantly, healthy holiday season. With that, we'll open the floor to any questions for any of the speakers. All right. Well, thank you very much.